Silent heart attacks are a growing concern among doctors. According to the American Heart Association, silent heart attacks are caused by a sudden and severe rise in blood pressure that causes a blockage in an artery without any other symptoms. Please don't forget to subscribe. Sudden fatigue. If you feel fatigued, it's important to remember that this isn't always the result of a silent heart attack. Fatigue is one of the most common symptoms of any heart attack. If you're experiencing fatigue and have other signs such as shortness of breath or chest pain with exercise, your heart may have stopped beating properly during an actual event. This can happen if there is damage to both sides, ventricular, or just one side, left ventricle, which causes blood flow problems in these areas, leading to decreased oxygen delivery throughout your body. Shortness of breath. Shortness of breath is a common symptom of a heart attack, and many things can cause it. If you experience shortness of breath that lasts for more than 30 minutes, it's essential to get checked out by your doctor immediately. Other conditions that can cause shortness of breath include 1. Lung disease, such as asthma. 2. Asthma medications like albuterol or nebulizer treatments. 3. Heart problems include angina pectoris, myocardial infarction, heart attack, arteriosclerosis, and cardiomyopathy, heart muscle disease. Nausea or dizziness. Nausea and dizziness are common heart attack symptoms, but other conditions can also cause them. If you experience nausea or dizziness, seek medical attention immediately. Pain in the upper body. If you experience pain in the upper body, it's essential to know that this can be a heart attack symptom. Pain can be felt throughout your chest, back, arms, and neck. You may also feel pain in one arm or jaw, or both. If you see any signs of chest pain or pressure, for example, discomfort when breathing deeply, feeling like something is caught under your collarbone, difficulty speaking, it's time to call 911 immediately. Sweating. Sweating is a normal response to a fever. It's also a sign of an impending heart attack, but it's not always recognized as such. If you're suffering from any other symptoms, like nausea or shortness of breath, which can happen even if you don't have any outward signs, it could be worth checking in with your doctor before getting too worried about sweating, and then advising them on what that means for their social life. Anxiety and depression. Depression can be a symptom of a heart attack. It's not always the case, but it is possible. Depression can also indicate something wrong with you, such as anemia or blood pressure problems. Depression makes you feel like nothing will ever get better and that everything around you is hopeless, even though people are trying to help you through it all. You might also feel like eating less food because food doesn't taste good anymore, or because every time someone brings up food in conversation, like at dinner, they make fun of how fat, thin, chubby, skinny your body is. This makes eating difficult because then everyone thinks about how much weight loss would help them lose more pounds than they already have gained over time due to stressor outside their control like work stressor, etc. Lack of energy. 1. You may feel tired or even exhausted. 2. Your heart may feel heavy as if it's not pumping enough blood to the rest of your body. 3. You might have difficulty breathing, especially if you're taking medication for your heart condition. 4. You may experience a sudden change in your exercise routine and find yourself getting winded easily after walking upstairs or doing household chores. Sleep disturbance. Sleep disturbance is a common heart attack symptom, but it is often ignored. Sometimes the only way to know for sure if you have a silent heart attack is when someone notices your sleep disturbance and tells you about it. Sleep disturbance can be caused by anxiety, stress, or depression. It can also be caused by anemia or sleep apnea, a condition in which breathing stops during sleep. In some cases, abnormal heart rhythms can cause someone to feel tired during their daytime hours and evening slumber session. Pain between the shoulder blades. Pain between the shoulder blades is a common heart attack symptom, but other health problems can also cause it. If you experience pain in this area, seek medical attention immediately and tell your doctor about any previous experiences with chest pain and shortness of breath. Rapid heart rate. If you are experiencing a rapid heart rate, it is essential to seek medical attention. If your heartbeat is over 100 beats per minute or higher, you should refrain from exercising and call 911 immediately. Rapid heart rate, more than 180 bpm, call 911 immediately and ask them if they can send an ambulance directly. If it is not an emergency, but you feel like something isn't right with your body, and there's no way around having this checked out by a doctor or nurse practitioner as soon as possible, then go ahead and get yourself checked out by someone who specializes in cardiac issues before getting back into shape. If you experience these symptoms, don't ignore them. Stomach pain. This may be the most visible sign of a silent heart attack and can be immediate or delayed in onset. 1. It's essential to seek medical attention immediately if you have any stomach pain that lasts longer than 30 minutes or feels like it might be coming from somewhere else besides your chest area, i.e., chest pain. Fatigue. Being tired all the time is one of the first signs people notice when they have an irregular heartbeat. And this fatigue isn't just physical. It also affects your energy levels so much that even simple tasks feel overwhelming at times. If possible, try taking some time off work over the holidays to focus on getting well again without feeling guilty about leaving the job early every day because you need rest more than anyone else does now. Conclusion. Don't delay seeking medical attention if you experience any of these symptoms. The sooner you discover what's going on with your heart, the better off you'll be. A silent heart attack can be dangerous and even fatal if left untreated. Thanks for watching. Please don't forget to subscribe. Your subscription gives us a power to continue. See you soon.